Hello, everybody. This is Andy Malakoff. I'm the Executive Director of North Shore Child and Family Guidance Center. We're a children's mental health agency located in Long Island, New York. And I'd like to greet you all and welcome you. May is Mental Health Awareness Month. And we felt that this webinar was a great way to kick it off. And we hope that you all will keep the conversation going. We originally thought we were going to have a small group of participants, but it turned out that we have more than 130 people that have registered. So thank you. And not just locally, but from all across the world. I've had emails from New Zealand and from Australia, Canada, and so forth. So it was quite a surprise, but I really appreciate your participation. On March 1st of this year, there were 100 confirmed cases of COVID-19 in the United States. Today, 2 months later, on May 1st, there's more than 1 million confirmed cases. And that includes more than 60,000 people that have died in the United States. Worldwide, there's almost 3.5 million people that have been confirmed cases of COVID-19, and there's almost 250,000 that have died. So this is really a hard time for kids with all the loss and change and being stuck at home. It's a formula for stress, anxiety, and conflict. Parents have a lot of concerns, we're learning, and we made a transition from being on site in an office to moving to remote conferencing, such as we're doing right now. And that planning went on with our top administrative staff for a few weeks, but just as we were about to make that transition, all of a sudden, a number of our colleagues were determined positive and were infected, and obviously had to do what they needed to for themselves and their families. And we really made a seamless transition. And certainly the hundreds and hundreds of kids and families that we work with were most appreciative that they were not abandoned at this very difficult time, because this is an issue that everybody's dealing with. We're dealing with it personally, and all the families we're working with, regardless of why they came to us in the first place, this is what's primarily on their mind. They have a lot of concerns: what kind of structure to have at home, how to alleviate their children's sadness, fear, and anxiety. How do they know whether or not they need professional help and how to access that? We hope to answer some of your questions this afternoon with our expert panelists, all clinicians at North Shore Child and Family Guidance Center. I'm going to ask each of them one by one after I introduce them to speak briefly, and then we'll answer your questions. There's a Q&A box there. I've also received quite a few emails with questions, so I'm sure that I won't be able to get to everyone's question with 125 people tuned in, but hopefully the ones that we do address will be representative of what at least some of your concerns are. Okay, so before I introduce them, I want to say I had a dream last night, and in my dream, Dr. Fauci called me and said he was really sorry that he could not attend this. We thought he might be on the panel and you'd get to see him up there as well. But what he did say is that he was really glad that we were paying attention to this today, and that there were 130 people who were a part of it, and that at the same time that they flattened the curve, he's glad that we're all working together in the same boat to flatten the mental health curve. So with that, let me introduce all of them together and then individually as they speak. To the upper left of your screen is Vanessa McMullen. Vanessa is with our early childhood services, and in addition to everything she does there, she also oversees our work with with moms who are living with perinatal mood and anxiety disorders. It's part of our maternal depression program. To the right on the top is Alyssa Smilowitz, who oversees our triage and emergency service. And part of the seamless transition was that we continue to take emergencies. We've received increasing number of referrals since we went remote from hospital discharges and also urgent care. And our pledge there is to see everyone within 24 to 48 hours. So we have no waiting list. To the left on the bottom is Regina Barros. She is the Associate Executive Director of the agency and has overseen a lot of the clinical operation during this transition, and has also been responsible for developing a very special program for Latina girls. There's a very high incidence of suicide among that population. And as you know, if you're dealing with COVID-19, which I'm sure all of you are, you know that the issue of health disparities has been very pronounced. And we see that in the work that we do, not only with that population that Regina works with, but many of our other clients. And finally, to the right on the bottom is Dr. Jolie Pataki, who is a psychiatrist who really works with our clients across the board. And I'm sure we'll have some very interesting insights from a psychiatric perspective. So to begin with, I'd like to ask each of the panelists to speak for 3 or 4 minutes, and then we're going to open it up to question and answers. So Vanessa, do you want to begin? Vanessa McMullen.
Sure. So, in dealing with young children, there's a lot of times this misperception that they aren't as impacted by what's going on because they don't fully understand the circumstances, or maybe because their routines aren't as different because maybe they only went to school a few hours a week. But so even though they may not comprehend what's going on fully, they are very aware that something is going on. And this is stressful to them. It may be as simple as missing a grandparent who was a consistent caregiver for them. And now all of a sudden, the grandparents can't come over. Or if they do, they stay outside and they wear a mask and, you can't give a hug. And the children aren't understanding why. But they are certainly in tune to the fact that the people around them are stressed out. And we all are, because, this is a really unprecedented situation. And trying to manage children, in addition to everything else going on and our own stress, really feels impossible. So we know that children do better when they feel safe, when things are stable, and when they feel secure. And that's just not what's happening right now. So what children are having difficulty with at this point is emotional regulation, which is the ability to cope with their feelings. So in young children, this looks like aggression. It can look like oppositional behaviors, not following directions, anxiety, tantrums, sleep difficulties, maybe not wanting to go to sleep, clinginess. This is how children communicate that they're not feeling well, through their behaviors. So one of the best things that we can do for them right now is to really try to regulate themselves. And a lot of that has to do with how, as adults, we regulate ourselves. And one thing that I found helpful from a training that I went to was just trying to look at the children's behavior a little bit differently, which is, instead of calling it misbehavior, look at it as stress behavior. So even as adults, we respond differently when we're stressed out. And what's happening now is kids and adults are feeding off of each other's stress, and that's really causing things to get more out of control. So, we want to try to be in tune to how we're responding to children. We also want to make sure that we are limiting their exposure to media or adult conversations. We assume that they don't know what we're talking about, or that they're not understanding, so it's fine, but they're listening. And, even if they don't understand the specifics, again, they're getting that tone that something is stressful. And, they may make their own inferences. For example, if they overhear a conversation about people dying or it not being safe to go outside, they are possibly going to make a generalization about what that means. They can't distinguish the circumstances that, that of what's happening, and may be anxious about anybody going outside, including themselves. So using it as an opportunity to really talk to them, explore what their understanding is, try to correct misinformation, and really try to provide reassurance about you being there and that everything is okay. That's really important. You want to listen to the kids. We want to encourage them to talk. We don't want to shut them down. We don't want to minimize feelings. Sometimes a response might be, if a child says like, oh, I miss school. A parent could respond, well, you always gave us a hard time when it was time to go on the bus. That's shutting down the conversation. Instead, validate, I know this is hard. It has been a long time since you've been to school. And encourage that dialogue to continue, and give them the reassurance that you're going to get through it together. They need to feel safe. They need to feel secure. And I know as adults, we're not necessarily feeling those things ourselves, but making sure that we communicate this to young children is really essential in helping them cope themselves.
Okay, thank you, Vanessa. I just want to remind, if anybody came in a little bit late, that we're going to go till about 12:45. And also, so that you know that this is being videotaped, and so it will be available. There'll be a link. All that'll happen, soon after the webinar. So now I would like to turn to Alyssa Smilowitz, who, as I said, oversees our triage, emergency, and high-risk service.
Hi, everyone. So I am also a supervisor in our Roslyn location. I also supervise our triage program, which is mostly adolescents. However, I do work from ages 10 and up with the clinicians. What I'd like to talk about is how we as adults are being able to tolerate what's going on in this world. When I go through difficult times, I look at it as a challenge. It's a challenge because at this time we have to figure out what is in our control and what's not in our control. So what this causes is us to self-reflect, similar to like what Vanessa was saying, that we need to self-reflect, we need to look at it as a challenge and create some strategies of being able to tolerate this. And as we do that, we also have to do the same for our adolescents and young adults. Through these times, I find that there's a lot of emotional growth. We learn what we can do to strengthen our resilience in dealing with times that are difficult in our lives. This is an unprecedented and difficult for everybody. But adolescents and young adults are going to experience other areas in their lives when they're going to have to deal with these situations. So it's very important to, have a dialogue with your adolescents, letting them know they're not alone in this, validating their feelings, just like Vanessa was saying, but also recognizing that we have our own issues that we have to deal with. We have to be able to recognize our anxiety and our stress level and our frustration in this, and not pass it on to the adolescent. So it's very important that when we talk to our adolescent or we're frustrated with them, that we take a step back and take a breath. Recognize that they're struggling with this too. And it might come out similar to like young children. They might be more defiant. They might be a little more behavioral, recognizing that this is part of what they're going through and how we can help them control that. Routine becomes very important for adolescents, healthy choices, taking care of ourselves. These things we have control over. And these are the ways to help them tolerate what is going on in this time. Thank you.
Okay, thank you, Alyssa. And also I see there's some, questions and comments coming in, and I will get to them after the next two speakers. And as I said earlier, we'll try to get to all we can, but we can't promise because I see there's more than 100 people on right now. So now I'd like to turn to Regina Barros Rivera to pick it up from here.
That's all. Excuse me. Thank you for letting me share. We've been traumatized as a country. We are experiencing tremendous grief and loss. We have situations affecting our families that range from losing a father, a mother, a grandparent, extended family members, not being able to attend funerals, not being able to connect to each other. With that said, we are in this together. We have to figure it out. And we are working with our families and the children and the adolescents to figure that out together. It's an opportunity to look at what we have had and help our adolescents and children mourn that. So, I've been doing a lot of work with the kids, with especially the teenagers, and if they haven't lost a parent or a grandparent, they have lost their dreams, the dreams that they walked into life thinking, I can't wait until I graduate, the sports, the graduations, the proms, college. There's all of this loss, the loss of those dreams. So what I say to all of you, and which is what I'm saying with my clients, what we have is the here and now. Let's take a look at what we have today, validate that there is that loss. And remember, your teenagers, they feel everything so much stronger. They have their feelings in a way, this is like truly the end of the world for them. So as a parent, we can't minimize and say, no, it's not. They feel it is, so they should be able to talk about it. They've lost their peer connection and the way they had it. So I think what we look at is, how do you reconnect? How can you reconnect as a family? How could you help them connect with their peers in a different way? Look at the rituals, because these rituals have been with us for generations. They've lost them. They're gone as of this for now, since we've been sheltering at home, we've lost the regular rituals. So I also say to you, work with your adolescents to create new rituals. Work out with them. They're resilient. They're wonderful. I find them wonderful to work with. So once we talk about what you've lost, what do you want? What can we do? And offering hope. What is that hope look like for you, for your family? And I don't want to, each of you watching here has had a different story, and I'm sure that that's a very personal one. But I think the basic core principle is that we're in this together. It's new to all of us. We've never experienced this, but we're going to be okay. We are going to be okay.
Thank you, Regina. And your timing was perfect, because although we're not going to respond further at this point, you addressed it. But there was a question that came in about some of what you talked about. And actually, I just looked on my phone, and there's a tweet here from Andrew Cuomo, the governor of New York, in which he says, given the current situation, K through 12 schools and college facilities will remain closed for the rest of the academic year and will continue to provide distance learning. This is the best course of action to keep students, educators, and staff safe. But of course, there's lots of concern, as you just referred to it, Regina, for people that are going to lose, many of the rituals, particularly for the, for the seniors. But we'll get to that a little bit later. But it just came in right now when you were speaking. So Jolie Pataki, Dr. Pataki, you're up.
Okay. Hi. So I'm Dr. Jolie Pataki, as you heard. I'll probably be reiterating a lot of what the other speakers said. I'm actually speaking as both a parent and a psychiatrist, and you can decide which one of those hats I'm wearing at this moment. But the reality is that our world has been turned upside down. Some days it feels like we're in a science fiction movie. There are so many areas that now present problems, new problems. I treat mostly adolescents, and I hear a lot from their perspective, with the parental perspectives after that. Most of the teens have been expressing concerns about the difficulties with schoolwork, excess load, having to teach themselves new concepts, and lack of motivation. So, of course, seniors as has just been raised, are now very concerned about graduation, what that will be like, what will it mean to move on to college, and so forth. Parents are actually mostly complaining of the reverse day-night sleep cycle. As far as the schoolwork, each district has been handling it differently. They are aware of inherent differences, and my expectation is that the districts are trying to be flexible. I was actually in touch with a local superintendent of schools who himself expressed concern about students not feeling too overwhelmed and interested in trying to deal with that. And as far as that goes, I would certainly encourage parents and students to reach out to teachers, social workers, guidance counselors in their schools to try to deal with that kind of an issue. The conversations are important because maybe there can be a compromise so that students won't have to feel as overwhelmed by these workloads. On the other hand, trying to micromanage your student is, not always the best thing. You have to choose your battles. An important concept to master when one becomes a parent is to choose those battles. As far as sleep, I know that, that's been voiced as a frequent concern. The normal rhythms, circadian rhythms, as they're referred to, are usually best sleeping at night in the dark and being awake during the daytime when it's light. That's the normal rhythm, of course, but the problem is, as long as the actual amount of sleep is okay, in other words, actual numbers, whether it's kind of during the daylight or at night, you're probably okay. It's certainly important to encourage what we call sleep hygiene, and you can look up resources for that all over the internet. But, the reality is that, again, it's a battle, and it's going to be very difficult to maintain those kinds of rhythms. Some simple things you might try to do is to make sure that your student has light in the morning, pull back the curtains, make sure the windows are open so they can hear the birds chirping. Maybe you can make noise, household stirring, start breakfast so they can smell the breakfast cooking. And if none of that works, offer them some kind of bribe. I don't know, maybe have cookies for breakfast. The point is to get the individual up and at 'em in a way that would be effective. But again, battles are chosen depending on how serious the problem is. There are medications that we can consider, but in something like this, I would only think about something like melatonin, which is actually a natural hormone that promotes sleep during the right time. Again, if you want to look up resources, the American Academy of Child and Adolescent Psychiatry and the American Psychiatric Association can give you specifics. But again, set realistic goals and with that in mind. We as adults also are having trouble dealing with these rhythms. So again, everything with a grain of salt. As far as anxiety, children, of course, are anxious. We're all anxious in this day and age. And the fear of getting sick is probably paramount. Each family has their own circumstances. So again, your response to that is going to vary. But families should encourage kids to express themselves, to try to get out what your child is actually fearing, which actually may be very different than what you think they're worried about. Mm-hmm. It's important to be honest. It's important to have frank discussions because children will imagine all sorts of things. If you don't give them some reality, they will have fantasies about things being probably far worse than they are. It's important to get accurate information like CDC websites, again, or other national websites, but it's also important not to overdo it. Stop listening to the news. Pick one modality, listen once a day so you're updated and informed, and then turn it off because you can very easily get overwhelmed. You got to distract yourself. You can develop old hobbies or work on new ones, but it's important to break up the day and not just obsess over, what's going on in the world. We all have to live with some anxiety at this point. That's the reality. But we will come out of it. There will be a new normal. So we all have to sort of expect that. But play to your strengths. Try to include humor. I rely on that quite a bit, although not everybody thinks I'm so funny, especially my own children. but we need to include that in the course of our day, even within this very serious situation. You know, even if you're not sure what to say or what to do with your child at any given situation, just being there is very relevant and important. Parenting is, of course, very stressful at this time. We all feel isolated, but we're kind of all alone together. And that's pretty much where I'll stop. Thank you.
Okay, yeah, it's interesting. Again, you're just like the other panelists, you're in tune with the audience. We had a question come in before you started that said that their teen can't sleep at night, and so they sleep all day, and they're working during the day. You had said something before about as long as they get the amount of sleep that they need, that's what's important. So would you add anything to this attendee who had this question?
Again, you know, it's going to be really, really difficult to try to put the sleep-wake cycle back to normal. I think it's probably not going to happen at this point, because when you're not getting out of the house, you don't have the same kind of motivations and expectations. It's really hard to do. But again, as long as the child is functioning, as long as they're getting some schoolwork done, I think you have to back off a little bit. Or maybe even approach the kid and say, listen, what would make you happy? What would make you feel good? And can we then work together to try to slowly make things more balanced as far as timing? But I wouldn't overdo it.
Right, and what you said before, I think, is so important, that you have to pick your fights.
Right.
And so I have a question here from, it's for Vanessa. My question is for Ms. McMullen. I have a 3-year-old who has exhibited signs of stress, especially when it comes to sleep. More of my concerns are when things get back to some sort of normalcy. She was in a separation program that she just stopped crying before this, and now I'm worried about having to do that over. Also, she is now with both my husband and I, and has become very attached. What do you think is something I can do when he has to go back to work and she's not with us as much? I feel this is going to cause even more stress than what's happening now. What do you think?
This is something that a lot of parents are worried about, because with young children, you know, they typically have more difficulty separating. So parents are really projecting into the future and trying to figure out what returning to a normalcy is going to look like. You know, my advice is really not pushing too far ahead. Really, the best we can do is focus on here and now. And when there is more of a concrete plan, that will be easier to try to explain with some consistency. So to say, you know, in the future, you're going to go to school, or we're going to go back to that program, or, you know, in the future, dad's going to return to work, it's too ambiguous of a concept. So you can say, you know what, we're really lucky that we have this time all together at home. And put out there, you know, well, maybe, you know, what would you like to do when we're, you know, going back to school, or when we get to go out to the playground again, and use it that way, but not try to put in specific things now to help her later, because we don't know what later is going to look like.
Okay, thanks. Regina, we have a question about something that you talked about a bit. It's about how when there's a death in the family now, it's a lot different without the, you know, the rituals and the connection that was there before. What do you suggest as far as how people can, you know, how parents can help their children when a grandparent dies, or someone else that's very close to the family?
So I know people, this is has been horrific for families, awful. I have heard stories where they said goodbye to the person at the door when the ambulance took them, and then they disappeared, and that was it. And so you have adults that are mourning, they're devastated. And so you have kids who are kind of watching, like Vanessa says, the little ones are kind of watching and confused. And the teenagers, they just express their feelings differently. So you may not even think they're thinking it, but they may be feeling horrible. So there's new ways are being created right now to figure out how to have a funeral using virtual. There are people who are specializing it. You could Zoom as families. I'd say select a family member that's good at making the connections between the family members, getting people to talk. You could have this, what we're doing, and give everyone 2 or 3 minutes to talk. You could hire a person who now has specialized in doing virtual rituals for funerals. They're fantastic. I know of them. It's just people who have a great heart, who were able to like say, we need this now. They're collaborating with funeral directors who I heard this morning, they're at their wit's end as well. My message to you is you have to deal with it. You have to talk about it and have to acknowledge that it is different, and we have to use another way of dealing with of creating a ritual to deal with the loss.
Thank you. And Alyssa, we have a question from a father who says, my son pointed out a story in the New York Post about a record number of suicides in Queens in the last month. He has seemed really down in the dumps, especially the last few weeks. Do I have anything to worry about? I'm afraid if I talk to him about it, it might give him ideas.
I think that it's important to talk about that. I think open dialogue is important to help him understand what we're going through, encourage some healthy choices that he can do to help him with his anxiety and with his depression, and work with him. So ignoring it sometimes is not a good idea, because then the child is experiencing this alone, and they really need to have a parent have that conversation and say, listen, it's very sad what's happening in the world. It's very sad what's happening here. But you know something? I'm here for you. I can listen to you. We can work on doing some things to help ourselves feel better. This is when parents have to become creative. They really have to figure out what's going to work for the family. And it's important that the family connects, that they shouldn't be, even if they're in the house, they shouldn't isolate. They need to be together, and they need to mourn, and they need to share their feelings with each other. So I think that it's really important to discuss. But then you can also talk about, okay, so maybe we should take a walk. It's a nice day outside. Maybe we'll take a walk outside. Maybe, you could do a board game together. That is very important for children. They need that connection. They need that reassurance that we're going to be okay. So that's what I would suggest.
Yeah, someone I know suggested the idea of having COVID-free zones.
Right.
There's a period of time where you don't watch the news, you don't talk about it, and that you build in time as a part of your routine for fun, whether it's, games or artwork or music or whatever it might be. And so I think that was really very sound advice. Just to follow up, Alyssa,
Yeah.
If someone thinks it might be more than, just the COVID blues, for example, and they really become worried because of the isolating behavior and the, sort of, lack of emotional expression and some comments that might be made, what should they do about deciding whether to get professional help?
Well, what they can do is they can call the suicide hotline in their area. They can also call their mental health association and say, this is what my child is experiencing. Do I have to be concerned? And they could redirect them into whether they feel that talking to a therapist would be a good idea. I think that if the child is experiencing these thoughts and these feelings for a long time and not able to snap out of it or be able to redirect their thoughts, you might want to go in that direction. If they talk about, wanting to end their life, or they have a plan or intent, absolutely, you have to take that seriously, and follow through and making sure their child is safe. So it's really the parent that has to monitor them and see if this behavior is more extreme than what they have seen in the past and whether they feel that they're at risk.
And parents do know their children better than anybody else.
Absolutely.
So
Yes.
they should be, encouraged to go with their instincts. We have another question here for Jolie. Dr. Pataki, my 17-year-old high school senior had been doing great coming into the spring. Now, naturally, he has his moments of great stress and anxiety. Every week, this gets a little bit worse. He's on medication for depression and anxiety. Going forward, how will we know whether we should be thinking about adjusting his dosages?
Well, I think even when there's an explainable stressor, um, people get relapses. And if the relapse is consistent or persistent, I should say, there may need to be an adjustment. It's not always so clear. There's a lot of unknowns, but I would probably raise the concern to the treating provider. Let them know that there has been a significant deterioration in function, and make sure that there is active communication between your child and the provider. They certainly should be assessing whether or not there needs to be a change. I think one of the underlying problems, and as far as assessing anything in this environment, is that there's so many unknowns. Everything about our future is unknown. Everything about this virus is causing ripple effects all over our life. So from soup to nuts, you don't know what to expect in any area. I think that unknown itself is very anxiety provoking. And to the degree that we can sort of concretize things, make specific plans, I think it makes us feel a little bit reassured. But I think the reality is we're going to have to live with some unknowns for a while. We just have to steel ourselves to that.
Okay, thank you. Vanessa, I have a 5-year-old boy who is generally a really good boy. He's definitely nervous and anxious and is acting out. For example, peeing in inappropriate places, intentionally, drawing, coloring on furniture and walls. What's your suggestion for a situation like this?
I mean, it sounds probably like attention-seeking behavior, which, with all families are all together, but adults are distracted, whether you're trying to work from home or not. People are spending hours trying to get groceries or check in on loved ones, and people, parents are looking at screens because you have to find a way to be informed. It's the only way we can stay connected. So my thought is that he's probably looking for attention, because when he does something like that and you notice what he's doing, you react, you give him the attention. And young kids especially can't distinguish between positive attention and negative attention. So putting in some sort of rituals, like everyone's saying, special activities together, show him that you are paying attention, make more of an effort to put the phone away when you can, and give positive praise when he's doing the right thing.
Thank you. And Regina, can you could you speak to the issue of health disparities in terms of what you're seeing and what we should help parents with when they're in situations where, that becomes a critical part of what their experience is in the country?
Oh, okay. Okay, I just wanted to jump in on the other question just for a little second with the young man who's feeling depressed. I think it's important, if a child was doing, or a young person was doing so well and now they're taking a dip, to help them to go from passive to active and take a look at, can they create new? So can they do something where they feel more fulfilled and have a sense of a future, as opposed to feeling like everything is lost forever, that all or nothing that adolescents have. But in terms of disparity, I know of families who have been terrified, who have just stayed at home and did not seek out medical care because they were terrified that the hospitals would not attend to them in the way they needed to be. And so they were also afraid of getting tested. If they were undocumented, they were afraid that then they would get deported. I know that they were also scared that they wouldn't be able to pay for their medical bills. It turns out that they are getting emergency Medicaid for people who didn't have insurance, so that's available. and the importance of networking with each other to find out what services and what hospitals are available for a population who is not used to using the traditional medical care. And that is, I'm saying, I see it a lot.
Okay, thanks. So I want to thank our panel and all of our attendees. I'm sorry I couldn't get to every question, but I'm going to wrap up now. Tuesday, May 5th is Giving Tuesday. Grieving, that was a real slip. It's Giving Tuesday, and we know now that these are challenging times for everyone, and that your philanthropy, wherever you choose to offer it, is really important. So please visit us at www.northshorechildguidance.org, or if you're in Nassau County and you want to make a referral to set up an appointment, you can call us at 516-626-1971, or email us at info@northshorechildguidance.org. And finally, to all the parents out there that have joined us today, or that will be seeing this when we post the link for the webinar, do your best to create a safe, loving, and caring environment. Kids are resilient. They will bounce back. And as Dr. Pataki said, we will get through this. Thank you so much.